Hi, I'm John Bermingham with the Board of Supervisors in Upper Mount Bethel Township, and I'm here at Dr. Raso's office. Thanks, Doc.
Good afternoon.
Doc, can you give us the latest numbers for Northampton County and Upper Mount Bethel Township?
Northampton County presently have 28,636 cases. 668 people have passed away from it, only 2 since the last time we spoke. Mount Bethel has 202. Bangor has 1,035. And Penargel's at 382, which really hasn't really changed that much in the last couple of weeks.
Yeah.
So I do definitely see we're slowing down.
Good. Any word on getting vaccines to Upper Mount Bethel Township?
Well, the 2 hospital systems are really waiting for the supply of Johnson & Johnson. They feel that'll be a big change. They're just waiting for the federal government to give them to us.
Great. Doc, according to the CDC, Pennsylvania has improved to 28th for the total doses administered per capita. In your opinion, are older adults and those with compromised immune systems having an easy time or difficult time getting in line to get the vaccine?
No, I would say it's a difficult time. Multiple people that I know are on multiple different sites trying to get the shot today. Today they had a very large shot place out in Wind Gap. I know a lot of people went there today, so I'm happy that they're starting to do that. I think we could have been a little bit more proactive, like Florida, where we would go to the grocery stores and give them to the old people on senior days.
Wow.
Which made sense to me.
Yeah. The CDC, which stands for the Centers of Disease Control and Prevention, said yesterday that most students only need to be spaced 3 feet apart in classrooms, according to their new guidance. What are your thoughts about this?
Well, like I've been saying, there's really been a very small incidence of young people under the age of 30 who've passed away from this. I think around the world it might be 45 right now out of 125 million. So that's a very low number. I think that's probably very true.
Okay, thanks, Doc. Özlem Türeci, who founded the company BioNTech and developed the first vaccine for the coronavirus, now says the technology behind it will soon be used to fight cancer. What are your thoughts here?
Well, clearly we're using gene modification and genes to try to produce what they call natural killer cells or T killer cells. And he's right. That's true. We're using it all the time now with Keytruda and all the other ones you see on TV. That's very similar to that.
Great. Recent reports have stated this week that the key to winning the race against another surge is not only whether the vaccines will play a significant role in preventing serious illness from COVID-19, but also whether they can block people from spreading the virus, such as those who are asymptomatic. Can you explain what asymptomatic means and what are your thoughts?
Well, asymptomatic are any person who's actually has COVID presently and doesn't feel anything. He's shedding viruses through his nose and he's spreading. He just doesn't realize it. I think what would really help most of us out is if they could come out with a test where you had a very rapid PCR test that they could do at home. I think that would help out tremendously.
Great. I have some resident questions for you. First resident question, does wearing a mask hinder achieving herd immunity?
No, I don't think so. No.
Okay. Next question is, I have had very serious allergic reactions. Should I get a COVID-19 vaccine?
It depends on what your allergic reaction is. The first 2 shots don't have anything to do with eggs or anything like that. So I don't think that would really fall into place.
Okay. Next question is, how long after having COVID-19 must I wait before getting vaccinated?
Well, some people say you can go 2 to 6 weeks after. Originally, though, I would say we came out and decided it was 3 months. I would still stick with anywhere from 2.5 to 3 months.
Okay. Next question. If I'm planning to undergo surgery, should I get the COVID-19 vaccine?
If you can get it, sure.
Okay. Can I donate blood after receiving a COVID-19 vaccine?
Yes.
And last question from a resident, does the COVID-19 vaccine affect antibody testing results?
Well, it should make antibodies. So clearly, if you have had the COVID-19 vaccination, within 2 to 4 weeks, you should have antibodies to it.
Okay, great. Anything else you want to tell the people of Upper Mount Bethel?
We're doing great. We're improving. I'm really happy to see it. I can tell you primarily at my office, I'm testing less people, and I'm very happy.
Great. And Doc, we've been doing these interviews now for a year. So I just want to say, on behalf of the people of Upper Mount Bethel Township, we're really grateful that you come and speak to us.
My pleasure.
Thanks, Doc.